Paulina, and this is the physical assessment video for Nursing 1. For the purpose of this video, I'm going to be auscultating over the clothes, and critical elements like checking orders, checking that my supplies are working, and washing my hands and foaming have already been done. Hello, can I come in?
Come in.
Hello, my name is Paulina.
Hello.
I'm a student nurse here. Before I begin, I want to check some information with you. So can I have your wristband? Can you tell me your full name and date of birth?
Stephanie Hall, 5/16/86.
And your medical record number matches. Do you have any allergies to the medications, food, or environments?
No.
And do you have any pain? 0 being no pain and 10 being the worst pain ever?
2.
2, where is it located?
My head.
And how long have you had it for?
Just 2 hours.
Can you describe it for me?
Kind of achy.
Achy, and is it something that makes it better or worse?
No, not really.
Do you want me to do anything about it?
No, thank you.
Alright, so am I good to go?
Absolutely.
So I have an order to perform a physical assessment on you. It's gonna involve some touching. Is that okay?
Absolutely.
Alright, so I'm gonna start. Can you tell me what's today's year?
2019.
Okay, and then do you know where you are right now?
Valencia Memorial.
Okay, so the patient is alert and everything ×3. So I check the head and for any lumps, and the ears for any drainage or sores. Can you just look straight ahead? Okay, pupil size is 4 millimeters on both sides, and they're both round. I'm gonna shine this into your eyes. Okay, and then you can just follow this pen. So pupils are positive for Perla, meaning that they are equal, they're round, they're reacting to light, and they accommodate bilaterally. Can you look up for me? Okay, I'm looking at the nostrils. They are pink and moist, and the septum is not deviated. Can you open your mouth and stick out your tongue? Okay, members are pink and moist. The dentine looks good. There is no sores, no foul odor, and the tongue is not deviated. Can you smile for me? And the face is symmetric, and there's no face drooping. I'm gonna be touching your neck now. Okay, karate pulses are 2+ regular bilateral. Can you roll your shoulders back for me? Okay. And I'm assessing the skin, it's intact, the bony prominences, and then capillary refill is less than 2 seconds. Checking the brachial pulses, 2+ regular bilateral. The radial pulses, 2+ regular bilateral. And I will do the femoral pulse on myself, and it's 2+ regular bilateral. Can you push and then pull and then squeeze my fingers? Okay, so motor function of the upper extremities is 5 out of 5 on both sides. I'm assessing the skin on the lower legs, it's intact, the bony prominences. The popliteal pulse is 2+ regular bilateral. The posterior tibialis is 2+ regular bilateral. The dorsalis pedis is 2+ regular bilateral. And capillary refill is less than 2 seconds. Can you push forward, pull back, pull up, and push that? Okay. The motor function of the lower extremities is 5 out of 5 on both sides. I'm gonna be assessing your lung sounds now. So whenever I move the stethoscope, you can just take a deep breath. Okay, we can just place your hands on your hips. Okay, now you just turn around facing the wall. Alright, thank you. Now if you can lay down for me. So the lung sounds were clear and on labor, anterior, posterior, laterally, and bilaterally. Now I'm going to be assessing your heart valves. I'm going to start with the right side sacrointercostal space, which will be the aortic. Left side sacrointercostal space with the first pulmonic. Then will be the third intercostal space, which will be the second pulmonic. The fourth intercostal space will be the tricuspid. And the fifth intercostal space, midclavicular, will be the Apical pulse, and I'll listen for 1 full minute. And let's say it's 70 beats per minute. Rate and rhythm is both regular. What was the last bowel movements?
This morning.
And the last time you passed gas?
This morning.
What about the last time you voided?
2 hours ago.
Okay, and that's that regular for you? Right, so I'm inspecting the abdomen. It's not distended and there's no scarring. And I'm gonna auscultate. I'll start with the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. And then bowel sounds are active and present in all 4 quadrants. And then I'm gonna be palpating. Let me know if you have any pain. No pain, and there's no tenderness. All right. So do you have any questions?
No, ma'am.
Okay, again, 0 through 10, 0 being no pain, and 10 being the worst pain ever. How will you rate your pain? 0. Oh, that's great. So I'll be back to check on you in 30 minutes or so, right? Thank you.
Thank
So
you.
your call out is here. If you have any questions, let me know.
Thank you.
Thank you. So I'll document and wash my hands.